So the query is this, that why bronchial asthma, particularly the atopic asthma, is an example of type 1 hypersensitivity reaction. So there are two parts in this query. First, we need to be crystal clear in simple terms what is meant by hypersensitivity reaction. So what is hypersensitivity reaction? The idea is this, that our immune system is normally protective to us, beneficial to us, helpful for us, because it protects us as a line of defense from attack from the microorganisms which is coming from outside. But sometimes what happens that our immune system basically reacts inappropriately or excessively, or reacts to certain substances in the environment which is normally not harmful, like a pollen or an animal dust mite, or all these things, animal danders, all these things. So that kind of harmful immunological reaction which is caused by immune system, which causes tissue damage, is called hypersensitivity reaction. So in simple terms, hypersensitivity reaction means a harmful immunological reaction which is mediated by immune system, and rather than helping us, our immune system is causing damage to us. That's the basic idea of hypersensitivity reaction. Now, I'm not going to do the classification. I discussed those things earlier also. Now, coming to bronchial asthma, what is, or particularly the allergic asthma or the atopic asthma, which is the most common variant, what is the main problem? The main problem is this, that normally our immune system would not react if I inhale some pollens or house dust mite, because these are normally harmless to most of the individuals. But in certain people's immunological system, they would react unnecessarily inappropriate if they inhale these substances, like I mentioned, house dust mite or pollens, animal dander. Dander means kind of, you can think dandruff of the animals in that way, their skin flakes. So if those things they inhale, certain individuals, what would happen, their immunological system would get inappropriately activated. Particularly in atopic asthma, what happens, T helper type 2 cells, which releases certain cytokines, interleukin 4, 5 and 13, they get inappropriately activated. And when they get inappropriately activated, they release these cytokines, like IL-4, 5 and 13, which ultimately causes what? Which ultimately causes IgE synthesis, immunoglobulin E synthesis, and also causes later mast cell degranulation. So mast cells contents come out, eosinophils get activated by IL-5. So all these things ultimately results in narrowing of the airway lumen. Bronchoconstriction occurs by those mediators which are released. Plus there is increased vascular permeability, there is a release of synthesis of a lot of mucus. So those things basically progressively come and narrow the lumen of the airway, because normally the airway lumen is there. When the bronchoconstriction occurs, as a result of that, airway lumen gets constricted. And now when the further things are added up there, let's say mucus, flakes, epithelial cells, all these things, they even further clog that airway lumen. So airway lumen effective diameter even becomes lesser, and that causes obstruction in the flow of the airways. That's the basic idea in the bronchial asthma, particularly the atopic asthma. So what is the basic idea of the atopic asthma, allergic asthma? The problem is this, that a normal individual immune system would not react against these harmless substances. What are the harmless substances I mentioned? The various kind of allergens. What is allergen? The antigen which induces allergic reaction, they are called allergens. Like I mentioned, the house dust mite, animal danders, the pollens, all these things. So when a normal individual inhale these allergens, their immune system is not going to react. Their type 2 helper cells, they are not going to overreact or not going to release the interleukin 4, 5 and 13. But in certain individuals who are genetically predisposed, if you have a genetic predisposition to an allergy, those are called atopic individuals. These atopic people, what they're going to do, their immune system, the type 2 helper cell, they are going to inappropriately react, unnecessarily react against these harmless substances, because these pollens are not a dangerous bacteria, virus or any kind of thing. And they're going to react and they're going to release certain cytokines I mentioned, interleukin 4, 5 and 13. And that is going to synthesize a lot of immunoglobulin E. Ultimately, they're going to activate and degranulate the mast cells, releasing a lot of inflammatory mediators. And ultimate thing would be that there would be bronchoconstriction of the airway, smooth muscles. There would be bronchoconstriction. Plus, there would be release of a lot of substances in the airway. So let's say this is an airway. Let's say if this is an airway, what is going to happen? They first going to bronchoconstrict. Plus, there will be release of a lot of substances like mucus, mucin. There would be release of the cells also. So ultimately, those things ultimately is going to narrow down the clog the lumen further, causing respiratory distress, obstruction in the flow of the airway. So in simple terms, that is the explanation that why this is an example of type 1 hypersensitivity reaction. Because type 1 hypersensitivity reaction, if you revise also, you would get the basic idea is that this is usually caused by an environmental allergen, which is coming from the outside, like pollen, dander, all these things I say. You inhale them, and the reaction usually appears immediately. Why? Because usually these allergens, first time they sensitize, and the muscles get coated by this Ig. Next time when the allergen comes, they promptly degranulate. That's the basic idea. So that's all. That why bronchial asthma is an example of type 1 hypersensitivity reaction. Thank you.